So know what the injury mechanism is when you land on your feet falling off a roof. Bicyclist versus a vehicle, helmet, striking the head. Besides your ABC, what is more important for you to do? Stab wound to the neck. What would you be looking for? Chest to the steering wheel at 45 miles per hour, conscious alert, chest pain, short of breath. What kind of injuries does this person have? Roll over crash. Severe pain to the neck, top of the head, numbness and tingling. Wearing seatbelt. What's the mechanism of injury here? Gunshot wound to the belly. After doing your airway, how do you control the bleeding? And then what would you do? "25% of aortic injuries," so injury to the aorta, occur during what type of collisions? Blast injury, depressed area to the front. How did this injury most likely occur? GCS opens his eyes when you pinch. His trapezius muscle, which is that big nerve right there by your neck. Mumbling, arms are curled towards his chest. Give him a score. Blunt injury to the head, confused, headache, nausea. You should be more concerned with the possibility of what type of injury. Wearing lap belts only have a high incidence of injuries to what area of the spine during a rear end crash? The two most common mechanisms of injury for blunt trauma. Airbags, not wearing a seatbelt. That person's most likely to strike what? What type of injuries can you expect as a direct result of third collision in a motor vehicle crash? Know your three types of collision in a typical impact. Know your different types of velocities with gunshot wounds. Know your type of injuries during low energy penetrating injuries. Steel pipe to the chest, rapid, irregular pulse. What do you think is going on? Motor vehicle accident, young kid, front seat, wearing a lap belt only, airbag deployed. You should be suspicious of the child having what type of injuries. So you got a patient you scored at 13. Blood pressure now is 80. Respiratory is 8 breaths per minute. How re-rate this person? Kicked in the belly several times. Conscious. Pulse is rapid. Skin is cold and moist. Large bruising to the right upper quadrant. So what's the appropriate treatment for this patient? Severe nosebleed, blood pressure 180, 110, heart rate 90 and bounding. What's your method of treatment? Open book pelvic fracture, conscious, restless, pale, diaphoretic. Pulse rate 120, respirations 22. No external bleeding, so what do you do? Weakness, dizzy, melena. 2 days ago. Denies history of trauma. Blood pressure 90/50, pulse 120. So what do you suspect this person is experiencing? Severed femoral artery in the groin region. What's the best way to control the bleed? Gunshot wound to the belly. Semi-conscious, shallow breathing. Bleeding from the wound. You control the bleeding, your partner should do what else? Pressure dressing to the laceration. Blood is beginning to saturate. What should you do? Blunt trauma to the belly. Diffuse abdominal pain. Also pain to the left shoulder. Belly's distended, tender to palp. So what kind of injury should you suspect? What should you be looking for during your primary assessment? Know how to control external bleeding. What kind of findings would you find in a patient with possible internal bleeding? Know your basic techniques when controlling bleeding. What occurs after tissues are injured? severe nosebleed, epistaxis. It's important to recall that this patient may have what? Radiator burn. See ya. Anterior, both arms, chest. According to the rule of nines, what is the percentage? Crushing injury between the back of a truck and a loading dock. Arm has been freed. Deformity, swollen. Absent radial pulse. What should you be most concerned with? Belly evisceration, left lower quadrant. After doing his ABCs and assessing for life threats, how should you care for this wound? Electrocution, unresponsive, pulseless, and apneic. Power is off. What should you do? Struck in the head with a baseball. Confused, slurred speech, large hematoma in his forehead. Doesn't remember the events. After stabilizing his head and assessing his airway, what else should you do? Boiling water from the stove. 5-year-old. Superficial, partial thickness burns, head, face, anterior trunk. What is the percentage of body burnt? Incomplete avulsion, right forearm. You control the bleeding from the wound and then do what? 30-foot fall, landing in a pile of steel rods. Pulseless apneic, 10-foot steel rod impaled in his left leg. What should you do? Bicycle accident, puncture wound, impaled in his leg. What's the most appropriate method for treating this injury? Electrocution, when he cut a high power line, fell 20 feet, unresponsive on the ground, and the power line's across his chest. What do you do? So according to the rule of nines, the palm of the patient's hand is equal to what percentage of the body surface? Bite by a stray dog, large laceration to the back of his left hand, covered, bandaged. What else should you do to him? Industrial accident, eyes are closed, he is not moving. Large contusions to his arms, laceration to his forehead, minimal bleeding. A close deformity to his right leg. What should you do? How are burns classified? Why are burns to pediatric patients more serious than adults? Know your common signs and symptoms of an airway burn. Halfway through, 50 questions. Bar fight. Struck in the mouth, refuses care. Second patient, small laceration, left knuckle, also refuses care. Tell me what you need to do. Even with normal wound healing process, bleeding may occur from a minor injury. Why? Assault, contusions, abrasions to the face, chest, and belly. Weak, rapid pulse, skin cool and clammy. What should you do? Gunshot to the belly, large entrance, multiple small puncture wounds. More consistent of what type of weapon? Anterior nosebleed after he was elbowed. What's the most appropriate care for this patient? Redness, inflammation, pain to the left eye. Having difficulty keeping eyes open. What do you think she is experiencing? Assault, massive face trauma, slow gurgling respirations. Stabilize the head, and what else can you do? Peanut lodged in the canal of the right ear. What should you do? Sudden sharp pain to the left eye, a small splinter of wood embedded in this cornea. What do you do? Laceration to the left ear, minimal bleed. What's the appropriate care? Radar fluid splashed to the eyes. He wears soft contact lenses. What do you do? Steering wheel to the face in a motor vehicle accident. Considerable amount of swelling. Several teeth are gone. Minimal bleed in the mouth. Conscious alert. Normal vitals. What do you do? Clothesline to the throat. Difficulty breathing. Crackling sensation in the soft tissues. Around the neck. What's the best way to improve the chance of survival for this person? Laceration to the eyeball from flying glass. Moderate bleeding. Cannot see out of the injured eye. What do you do? Abnormal variations in pupil size and reaction. What kind of people do you see this? What type of people, I should say? Blunt trauma to the face, severe headache, decreased ability to move eyes. What is the clinical presentation of this patient? Blunt trauma to the anterior neck, labored breathing, loss of voice, subcutaneous emphysema around the neck. What should you suspect? Significant trauma to the face should increase your index of suspicions for what? Where are the optic nerve endings located? Unequal pupils, conscious alert. In obtaining his medical history, what could you ask him? Laceration to the side of his neck, bright red blood spurting from the laceration. What should you do? Severe facial trauma. The patient begins vomiting large amounts of blood. What do you do? "12-foot fall from the roof, landing on his feet, conscious alert, complaining of lower back pain, stable." What should you do? Suspected head injury, slow, shallow breathing. What's the appropriate treatment? Jumped off the roof, landed on his feet, complains of pain to his heels, knees, and lower back. What's the mechanism of injury? Person who cannot remember events after a head injury is experiencing what? Abnormal flexion of the extremities. What number would you give him for motor response? Goes back to your GCS. When does a reflex arc occur? Tight fitting helmet should be left in place unless what? Once C-spine is stabilized, what should you do? Bleeding within the brain tissue is called what? Know your signs and symptoms of a serious head injury. Know your common signs of skull fractures. Severe head trauma. Respirations are rapid, irregular, shallow, bloody secretions from the mouth and nose. What should you do? Closed head trauma. Slow, irregular breathing, slow bounding pulse. Your partner maintains C-spine, and what do you do? Head injury, opens eyes spontaneously, is confused, obeys your commands. What score would you give this person? If you don't have the appropriate size seat collar, what should you do? In a head injury, hypertension, bradycardia, and biot respirations include what? Or indicate what? Sorry. Know when you should immobilize a patient's spine. Most appropriate to perform a focused secondary assessment on a patient who has done what? Rapid deceleration of the head causes what? Know what your brainstem does, your cerebellum, your spinal cord, and your cerebral cortex. Sand blown into the eyes, pain and decreased vision. What's your treatment for this? Closed head injury, unresponsive. Pupils are bilaterally dilated, slow to react. Besides your ABCs, what else should you do? Gunshot to the chest, oxygen, rapid assessment, open chest wound, small blood, amount of blood bubbling from it. What should you do? Know the definition of a laceration. The pigment granules found in the epidermis are responsible for what? Cut to the wrist with a honey knife, conscious alert, bleeding significantly, what should you do? Large laceration to the leg with a chainsaw. Signs and symptoms of shock. You should first do what? Severe nosebleed. History of COPD, depression, and hemorrhage, stroke 3 years ago. Right now his blood pressure is 180 over 110, pulse 100. He takes albuterol, multivitamins. What do you think caused his nosebleed? It's 100.